Today I want to continue our talk on male issues, especially azoospermia, so that is the lack of sperm. As we previously discussed, azoospermia can be because of an issue with signaling from the brain into the testicle, or it can be an issue with the testicle producing sperm itself, that is an issue of testicular function, or it can be an issue where the sperm transport from the testicle to the penis is obstructed. Out of all of the three that we've discussed, probably obstruction is the easiest one to deal with and to understand, and that's what we're going to talk about today. In obstructive azoospermia, so that is where there is a transport system from the testicle into the penis, the testicular function is completely normal, so the testicle itself is producing normal amounts of sperm. The signaling to the testicle from the brain is also normal, and there is literally just lots of sperm building up in the testicle that cannot be transported out. The main route of transport of the sperm from the testicle into the penis is a tube called the vas deferens. This is a muscular tube, and what generally happens is that the sperm will build up in the testicle and it overflows and moves into the epididymis, which is a collecting duct system on top of the testicle. In that system, the sperm will gain ability to move, it will fully mature and then move down the vas deferens and empty out into the penis after going through various organs like the prostate. One of the most common causes of obstructive azoospermia, initial transport, is where this duct, this vas deferens, is missing or damaged. And the most common cause of damage is purposeful damage, so vasectomy. So where there has been a deliberate interruption of the vas deferens, it's been cut, it's been sealed as a sterilization procedure. Another common cause of obstructive azoospermia is a variant of cystic fibrosis. Cystic fibrosis is a genetic condition that is more common in Caucasian populations and then non-Caucasian populations. It is mainly known as a condition that affects the lungs, so we see lots of some people with cystic fibrosis requiring lung transplants because of the heavy mucus buildup. They are more likely to have chronic infections because of the mucus buildup. And the theory really is that mucus actually stops the development of the vas deferens in the testicle from an early age. So these people with cystic fibrosis have what we call ABD, so that is congenital bilateral absence of the vas deferens. So again, to reiterate, testicles are completely normal, no transport system. Other causes of transport issues are acquired causes. So some infections not only damage the testicles themselves, but they cause scarring and they cause fibrosis and obstruct the sperm from leaving the testicle. Some forms of trauma can cause this. What you will find in somebody who has obstructive azoospermia, so that is a blockage, is that all their hormones and tests will be normal, but when we examine the patient, we were not able to feel a vas deferens, and sometimes ultrasound images, ultrasound techniques can also find causes of obstruction. The treatment for this is either to reverse the obstruction, so if there is a vasectomy, then you can try reversing the vasectomy. The rates of success vary between sort of 50-60% to 90%, depending on the timing from the vasectomy to you reversing it, to other sort of concurrent factors, including the female partner issues. The other option is to do what we call a needle aspiration from the testicle. A needle aspiration is done either under local anesthetic or under general anesthetic. This is where a needle is passed through into the testicle and we aspirate some microtubules, so which are the little thin tubes that produce sperm, and we hand it to our scientists, and they can actually express the sperm out from those tubules and use it for essentially IVF. And if there's anything else that that is left that is not used this cycle, we can actually freeze it. You can also do aspiration of the epididymis, which is that storing structure. Generally, sperm that is retrieved surgically via needles should be used for IVF because it's not very motile. Some of the sperm you get from the epididymis may be motile, but generally speaking, we would recommend this as a technique for IVF.